Nurses' sick days are on the rise, with a quarter of days lost due to mental health issues. Let's let that sink in. 1 in 8 nurses who have called in sick took days off because of anxiety, depression, or stress-related illnesses at some point last year. Compared to 2021-22, the number of nursing days lost has risen by 473,000 days. That's the equivalent of 2,000 full-time nurses. In 2024-25, over 8.2 million days were lost by over 340,000 nurses. Of course, nurses are under pressure. No one doubts that. But rising absenteeism has very real consequences. These are cancelled operations, delayed diagnoses, and long A&E waiting lists. And overworked staff are picking up the slack. Not every sick note is avoidable, of course. But when 1 in 4 days off is linked to mental health, we have to ask the question, is the system doing enough to support staff, or is it enabling prolonged absences? Union leaders say that this is part of the wider NHS staffing crisis, and that may as well be true. But with fresh pay disputes on the horizon and junior doctors already threatening more strikes, it's time that we had an honest conversation about accountability as well. The NHS pay review body is expecting to recommend a 3% pay rise, broadly in line with inflation. But after years of rising pay demands and falling productivity, again, we have to ask, what's the plan to get the system back on its feet? If even more nurses are preparing to walk out over pay again, what hope is there for clearing backlogs and improving care? Taxpayers are footing the bill for this, and patients are paying the price. If we want an effective healthcare system, we need nurses to turn up. This means facing hard truths, not just writing bigger checks. It's not enough to throw more money at the problem. We need fundamental reform. Sign up to our War on Waste bulletin to find out more.